Yes, sir. I'll start. Good evening. I'm Dr. Kesha Jani from IAP Digital Media team. I'll be hosting your today's webinar on safety and health at work from physiotherapy perspective with resource person Dr. Vishal Johnson, being organized by IAP Pathanamthitta branch Kerala state. The IAP is the oldest and largest association representing physiotherapists in India since 1955. The IAP Digital Media team consists of a group of physios who handle Zoom platform webinar, live streaming, and IAP profiles on social media platforms Facebook, Instagram, Twitter, LinkedIn, YouTube. Follow IAP profiles on these social media to receive notifications for our events such as webinars, workshops, CMEs, conferences, health camps, etc., and to know the recent updates on physiotherapy. Subscribe to IAP YouTube channel for notifications of our live webinars. In playlist section of this channel, webinars are segregated into folders on various topics like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary, women's health, research, cancer rehab, etc. for your easy access. The social media link will be shared in the chat shortly. Thank you.
Let me start now. Good evening to all the doctors present in this online platform. Today's topic, safety and health at workplace, physiotherapy perspective, is conducted by IAP Pathanamthitta chapter, Kerala. To begin with, I call upon the convener of IAP Pathanamthitta district, Dr. Nishad S. to deliver the welcome address.
Good evening, everyone. Respected Presiding Officer Dr. Vinod Das, Kerala State Vice President, and our respected Chief Guest, Kerala Chapter President Dr. Sri Namburi Sir, all panelist members and fellow physiotherapists, and Indian physios and physio students. I am Dr. Nishad S., convener of Pathanamthitta branch. I would like to welcome you, all of you, for this wonderful webinar section, which can spread a ray of knowledge toward the physio community regarding the workplace safety and health of respective physiotherapists. I take this opportunity to convey the gratitude and thanks on behalf of all my executive members to the IAP Central Executive Committee members for selecting the best branch in India on national conference at Ahmedabad. Thank you. We assure you that we will keep continuing the work for the benefits of the physiotherapy community and to the entire nation. Let me welcome Dr. Vinod Sir, who is the presiding officer of today's meeting. He stayed with us all in all our needs, guided immensely, and he is our branch patron. Dr. Vinod Sir, we welcome you for this webinar section. Today's chief guest is our own Kerala chapter president, Dr. Sri Namburi Sir. He stays as the pillar of success all these days and proud strong base of IAP in Kerala with his strong leadership capabilities and still continuing he venture with a great dedication and determination of upliftment of the profession. We are very happy to get you as the chief guest who will be inaugurating the webinar section. Dear Sri Sir, we welcome to the webinar section.
Thank you. Thank you.
We have in our midst State Secretary Dr. Jim Gopalakrishnan Sir, District Coordinator Hari Krishnan Sir, State Women's Health Coordinator Dr. Jayasri Krishna, Dr. Vinay, our Pathanamthitta District Treasurer, Dr. Sabida, Pathanamthitta District Women's Health Coordinator, Dr. Vinci Daniel, District Coordinators, and today's moderator. Also, I would like to take this opportunity to welcome the National Digital Team faculty members who is arranging the webinar. Last but not least, I would like to welcome our speaker, Dr. Vishal Johnson, Secretary of IAP Pathanamthitta, and all those who gathered here in the webinar section, both in Zoom platform as well as in YouTube platform. Have a blessed evening ahead. Thank you.
Thank you, sir. Now I call upon the IAP Kerala State Vice President, Dr. Vinod Raj, sir, for the presidential address.
Good evening, all. Am I audible?
Yes, sir.
Am I audible?
Yes, sir.
Yes, sir.
Actually, I'm having a network problem. That's why. Anyway, most respected President of IAP Kerala Chapter, Dr. Sritam Namburi, General Secretary, Dr. Jim Govaleshan, my dignitaries on the panel list, dignitaries of your Zoom platform, and my dear physio fellows. Indeed, it's really a moment of pleasure that I am chairing a meeting hosted by my home chapter, IAP Pathanamthitta. And I think it's really a moment to, IAP Pathanamthitta is hosting this program after the big achievement. I'm not sure how many of you are aware of this great achievement IAP Pathanamthitta has gained. Has been awarded the best branch of IAP, over 400 branches in all over India, and I congratulate the great achievement in this moment. Anyway, I'm sure all of you are not here for lengthy speeches, so I'm cutting short my speech, and I'm sure everyone is eagerly waiting for the wonderful class being hosted by our secretary and also the today's panelists and the faculty, Dr. Vishal Johnson. So once again, I wish all of you a wonderful session, and I wish Dr. Vishal Johnson to have a wonderful session. Thank you.
Thank you, sir. Now I request the shining star of IAP Kerala, Dr. Srijitam Nambudri, sir, for the inaugural speech.
Good evening. Can you hear me?
Yes, sir. Yes.
Yes, sir.
Good evening, all. Congratulations to IAP CEC team, CEC digital team, and also all the physiotherapists who have gathered here for the wonderful webinar. First of all, I would like to, as everyone said, Pathanamthitta branch is being awarded as the best branch in India, and they are hosting the webinar in this occasion. And they have come out with a wonderful topic, safety and health at workplace. We know that a physiotherapist can have a great role in preventing repetitive strain injury, postural issues, and ergonomic problems. Now, Dr. Vishal is coming with these things in a physiotherapeutic perspective, and also what guidance we can give to the patient. In this COVID season, we have to be more aware about the spreading of infections and all. I think Dr. Vishal may be covering all these aspects along with us. And without giving much time, without taking much time, I'm happily inaugurating this session. Hope everyone will be having a wonderful, enlightening session from Dr. Vishal and his team. Thank you. Thank you.
Thank you, sir. Let's move on to the felicitation. On the IAP Kerala State General Secretary, Dr. Jim Gopalakrishnan, sir, for the felicitation.
Thank you. Good evening, all. So, let me thank the IAP Central Committee for giving Kerala chapter this opportunity, and congratulating especially the Pathanamthitta branch for coming up with really need of our topic, which is safety of the health workers in this field. So I would like to thank our President, Dr. Srijitam Namburi, our Vice President, Dr. Hari Krishnan, Dr. Nisha, all the state committee members, all the state office bearers, all the branch office bearers, and all IAP members. And I welcome all the participants who are attending this session. And why I'm giving importance, like this is the need of the hour. As rightly said by Dr. C. Namburi, we all treat the train and correct the posters of the patients who all are coming to us. But we just don't realize that we are also getting into trouble by doing all this manual therapy the whole day, the whole week, the whole year. So slowly getting aged, we also experiencing the pain while treating the patients. So to be safe at the workplace is very much important. Like the ergonomics, usually the people what they do is they just try to fit into the circumstances where the workplace is constructed like. But it should be like that. The workplace should be arranged in such a way like a person can work without any injury or without any problems while doing in their during their working hours. So this is a very important aspect where Dr. Vishal Johnson has come up, and I'm sure that he will be throwing light to the area, and which will be very much beneficial for the physiotherapy community, students, and all the listeners. So I congratulate and I wish a best of luck for all of you and for this webinar, wonderful webinar. Thank you.
Thank you, sir. Now I call upon Care Women's Secretary, Dr. Jayashree Krishna ma'am, for the recitation.
Good evening, all. Hello. Good evening, all.
Good evening, ma'am. Good evening.
Yeah.
Good evening.
Good evening.
I, Jayashree Krishna, IAP State Women's Health Coordinator, would like to thank every one of you for joining in this webinar. I also extend my special thanks to IAP India, IAP Kerala organizers, and also IAP Pathanamthitta office bearers who put heart and soul in this webinar. And also, I would like to heartily congratulate IAP Pathanamthitta branch for winning the award during the IAP National Conference at Ahmedabad. I would like to extend my special thanks to Dr. Vishal Johnson, who is a dynamic personality who came forward to share his experiences on the topic of safety and health at workplace physiotherapy perspective. As we all know, in this digital era, we physiotherapists always come across a lot of repetitive strain injuries and also the postural problems in our day-to-day practice. Safety at workplace is really important in preventing the primary illness and also preventing the disability. I guarantee that, as the name indicates, the webinar will enlighten us very well, especially throwing light on the perspective of safety and health. I welcome Dr. Vishal Johnson. Have a nice webinar. Thank you all.
Thank you, ma'am. Now let's move on to the main event. Our eminent speaker is from Rani Pathanamthitta district. He completed his bachelor's in physical therapy from Vivekananda College of Physiotherapy in 2009 and followed by his master's in physical therapy neurology from Dr. MGR University. Very good mission with experience in India and abroad. He is presently working at VCare Physiotherapy Clinics, and he is the secretary of IAP Pathanamthitta chapter. He is none other than Dr. Vishal. Welcome you, sir.
First of all, I like to thank you everyone for the nice and wonderful words. And it's been an immense pleasure for me to be in the national platform. I would like to thank the national digital platform, National CEC, especially our pillar, Dr. Sri sir and his team, Dr. Jim sir, Dr. Hari sir. Dr. Hari sir was there from past 2-3 days arranging everything. So I would extend my gratitude to all the organizers of this event. Let me move on to the topic straight away. So today we are dealing with the topic safety and health at workplace physiotherapy perspective. So myself, I am Dr. Vishal Johnson. As introduced earlier, I am running a clinic, my own clinic at Rani. So we move on to the topic now. So let me have given an introduction. Most of the physiotherapists experiences work-related musculoskeletal disorders (WMSDS). So the Australian Occupational Health have given some practice of guidelines in the in that Jean E. Cromie and Valma Robertson and Margaret Obest. These are the three uh, people, three eminent personalities from Lathrop University, Melbourne, those who have given a guideline of practice where the in physical therapy. So what happens is that because of the musculoskeletal problems or other issues, health issues, 1 in 6 physiotherapy uh, physiotherapist will change his profession and they go to any other profession. So this is a study done in Australia a few years before, and they have made some guidelines in order to uh, keep the therapist in a safe environment, regardless of their regardless of the build, and in order to avoid the health and safety issues. Many of these disorders are attributed to manual handling of patients defined in any activity requiring the use of force exerted by a person to lift, push, pull, or carry, or holding an object. So, as a neurotherapist, I can say I used to carry, lift, and push, and I used to handle patients with my own help. So, this is one of the main issue that we face. An awkward posture in the course of their work can lead to musculoskeletal disorders. Let's see what are the 4 steps for ensuring the safety at your workplace. There are some steps which can ensure safety at your workplace. The workplace can be an ICU, the workplace can be an OPD, the workplace can be an IP department, general ward. So everywhere, wherever we go, we should be seeing these 4 things in order to be safe. The first one is hazard identification. So we should identify a situation or event which can harm people in the workplace. So it can be by anyone. So there should be a checklist in the workplace where we keep the injury records, where we have the consultation with the co-workers, like the colleague physiotherapist, and all the sources of information will be identified uh, by the chief physiotherapist, and uh, this is known as hazard identification. Then we'll go move on to the risk assessment. Once the hazard is identified, we will move on with the risk assessment. This assessment will keep us knowing what all problems that this hazard can create in our department or in us or with the patients. So, for example, I have given a risk assessment of manual handling. So in that manual handling risk assessment, there should be an assessment of the posture, assessment of the movements, forces exerted by the therapist, environmental conditions, duration of the task, and frequency of the task. So this is one example which I am giving it to you for the risk assessment. The next one is the risk control. So first we find what is a hazard, then we assess the risk, how much is the intensity of the risk. So then we'll move on to the risk control. How can we control the risk? So the aim is to eliminate the hazard or minimize the likelihood of the harm. The preferred option is to change the environment rather than the people working in it. So the first aim is to change the environment. Like we can increase the height, we can change the cabins, we can change the workplace design, like this. The control of manual handling risk is implemented by introducing design changes to eliminate the risk. This is what I'm talking about. So we cannot change the people, but we can change the environment. We can change the we can eliminate the risk. So reducing the risk where design changes are not possible, then we can give we give the therapist some breaks, some pacing, some rescheduling, like this. The changing of objects used in the manual handling task, like nowadays IASTM is very common. Before, instrument assisted soft tissue manipulation was not there. So nowadays more of IOSTEM is being used. It can be helpful in doing manipulation and manual therapy a little more effectively without straining much. And using of mechanical aids uh, when none of the previous strategies are practicable, like unweighing system, like a wheelchair or any other mechanical aids, we can use it. Providing training in performance of work to minimize the risk of injury. So any therapist coming to the department should be made aware of the risk factors of himself as well as the patient. So if you are considering the safety and health, we should consider the safety and health of the patient and therapist. The patient safety day is on September 17th. So we'll discuss more about patient safety on September 17th. But now this is our day, occupational health and safety in physiotherapy. So we'll see more of the safety of the physiotherapist. So the training program must be including the safe work of the therapists who are in our department. So it can be in ICU also. So ICU is very much prone to the infection, and also the patients will have much more complications. So all these things should be kept in mind. Then the final step is the review. The review is the final step. It is a systematic approach to risk management, and it is very effective when it is actually we will control the risk, and we will see how much is the controlling is effective in changing the risk or eliminating the risk. So this is a review. The review should be done at regular intervals. If there is any other changes needed, we have to change it again. So this is the 4 steps. So the first one is hazard identification. You should identify the hazard. Like example, I can give an example. Like an old machine is there in your clinic, and one of the therapists is passing by and is touching the machine, and you are getting a current or an earthing on your hand. So it is probably like a hazard. So we will check the risk, what it is, and we'll ask the biomedical engineer to come in, and and we'll see what all things can be done. So then the risk control. So the first thing, it is an old machine, so we can change the machine. So this is elimination. So we will eliminate the environment. So nowadays the machines are all not of metallic body. Before, when I used to work in 2010, the machines, some of the old machines were with the metallic body. So it will cause electric shocks and other circuit problems. So like this is a small example I'm sharing it to you. And after that, when you check the review, the new machine is coming in, so there is no issues now. So like this, we have to identify the hazard, then you have to check the assessment, how much risk it will be giving, and how can we control it. Then you review it again. Now we will move on to the safety issues, health issues faced by a physiotherapist. As a physiotherapist, I have been working from 2009. This is September, and I have been experienced some of these problems which I have noted here. And in the chat box, you can give some of your experiences also, what all things you faced till now. Okay, you are free to give your experiences. So the physical issues which I face is low back pain, which can be due to poor posture or continuous driving. Nowadays we get a lot of home care, so we'll move from one home to other home, so we'll travel a lot. So I will get low back pain, then upper back pain, using of lifting the patient or doing manual therapy or like this. Then stiff joints and muscle groups, like lack of proper stretching and warm up exercises. We'll start in the morning, we'll end in the evening. Like start by 8 and come back by 10. Then there is no time to relax and exercise. So there will be tight, stiff joints and muscle groups. It can also lead to injury. Then repetitive stress injuries, of course. Continuous manual therapy can give you tennis elbow or knuckle pain or recurrence disease or something like this. So these are things which I have faced, I have listed here. Then you will get a lot of stress or workload. In this workload of lot of stress, you may miss your meals. Sometimes I don't have food in the afternoon, then I'll have food in the evening. Then we don't drink much water. It can cause other issues, other health issues like gastritis and low back pain. Dehydration also can cause low back pain. tension, inadequate rest is there. Sometimes we'll come in the evening, then we'll see some cinemas and we'll go late to bed. It causes inadequate rest. So all these stress levels can lead to medical conditions like BP, diabetes mellitus, and other lifestyle diseases. So this is the issues which I have find it myself. So I just write it down for the webinar sake. So you can share your own views in one or two lines. Okay. Then there is an industry standards of physiotherapy which are given by the Victorian Work Cover Authority, where it have mentioned the emphasis of spatial requirements, that the clinical area, the clinic area or the OPD area should have a like this setting. So this is done into 1999, and they have also mentioned use of mechanical aids in lifting the patients and moving. And till now, there is no such good standards which is available for the optimal workplace design for therapists or those who are engaged in manual therapy. So as we physiotherapists, we can give some suggestions, or we can do some research work in this thing, where we can design an optimal workplace, and we can publish in the upcoming journals. The next is the proposed guidelines. So as physiotherapists, we have to follow some guidelines which can help us to maintain our safety as well as health in the workplace. So there are a few slides which I will be going through right now. Those are the guidelines which is given by the Australian Physiotherapy Journal in 2001 by Jean, Valma, and Margaret. So this is the guidelines. All physiotherapists must be familiarize themselves with the principles of risk management and being able to apply hazard identification, risk assessment, control, and review in their workplace. So this is what I have mentioned in the first session. The majority of the physiotherapists experience work-related musculoskeletal disorders like low back pain, neck pain, upper back pain, low upper limbs, and upper limbs are the most vulnerable to injury. Therapists must identify factors in the workplace and away from work that increase the risk of injury to those areas. Establish ergonomic guidelines for space, equipment, furniture, environment conditions should be mandatory in the design of physiotherapy workplaces. So, proper ergonomics. This is what we have to follow. By lifting a patient from the floor is different from by lifting a patient from a chair. It is different from lifting a patient from a bed. So all this lifting activity is lifting, but the ergonomics, the body posture should be such a way that your back is not hurting and the patient is also not hurting. So lifting activity is like that. Or if you are giving a manipulation or a manual therapy, you should have a different couch where the couch level is adjusted to the hip level, where you can manipulate or where you can do your therapy in a most ergonomic way in order to prevent injuries. Then the physiotherapist's job must be designed to ensure variety in the physical demands of the work. This may be done by scheduling different activities throughout the working day and the week, and by including a variety of techniques and treatment options into therapy sessions. Like one therapist can go to the manual therapist side or the neuro side, then to the electrotherapy side. Like you can shift the schedule. You can schedule the work of the therapist in such a way that the workload of the therapist is equally balanced. Okay, and the scheduling should be adequate, and regular rest should be given as involving the change in the posture as well as the activity level. So the as physiotherapists, it is good to say that we are dynamic, not like IT professional or any other professional where we don't sit for a long time. Okay, so we sit for some time, then we'll go to another patient, then we move on to another patient. Like we have a dynamic posture, so it reduces the risk, but still we have to schedule adequate and regular breaks. seeing a range of clients and the various conditions. That's what I just said before. Orthopedic condition is different from neuro condition. So the ergonomics is different in handling in both patients. So if you're seeing a wide range of patients, your body posture will be changing alternatively. If you are doing a same kind of patient, same kind of treatment, same session, means you will have a repetitive stress injury. So this we can avoid by seeing various conditions, by seeing a range of clients. Participation in policy development in healthcare to ensure reasonable workloads and adequate work environments. Increasing the range of treatment techniques at the therapist's disposal, aiming for variety in physical demands. Mechanical aids and equipment should be used whenever appropriate. Therapists must be trained in their use. So there are so many new mechanical aids is coming in. So we can buy, which is apt according to our financial level, we can buy it and we can apply it. So it can help us. The training must not be sole or primary means of controlling risk. Like if you are giving a training to the junior doctors or the other therapists, we should be train them in such a way that if they identify any type of risk, they should find the solution for that, and we should move on. And the training in injury prevention must contain the risk management model of controlling risk and including in principle preventive measures rather rather than training a specific method of techniques. Risk assessment and control must be ongoing. Once implemented, these guidelines must be examined for their effectiveness and modified where necessary. Risk management and review must be carried out at both an individual and institutional level. So this is done by the head of the department. The risk management will be reviewed by in individual level as well as the institutional level. Prospective physiotherapist must recognize the physical demands and constraints of the jobs. Students and qualified physiotherapists need to choose career paths congruent with their physical abilities. The thing is that if there is a physiotherapist who is short in stature, who is very lean, and other therapist he is very tall, his body build is good, so they can choose their own career paths. The big stout one can go in neuro, the small one can go in cardio. Like according to the situation, according to the physique, according to their abilities, they can choose the career. We have more specialties coming in now. So we have sports therapy, we have masters in orthopedics, masters in cardiorespiratory, masters in neurology, everything is coming in, OB-GYN. So according to the abilities of the candidate, the physiotherapist can choose their career paths. Then, according to the study by the Crom et al. In 2000, the body area with the highest annual prevalence of work-related musculoskeletal disorder is low back. It is 63%. Neck it is 48%. Upper back is 41%. Thumb it is 34%. Shoulder 23%. Wrist and hand is 22%. So we see it is low back is the main area which is affected in the physical therapy, according to Crom et al. In 2000, and we should be caring our back very much. And researchers found that the therapists who perform manual therapy perform the same task repeatedly. So many patients in one day, and who do not have enough rest are at the risk of neck and upper limb injuries. The thumb symptoms are more in performing manipulations and mobilization techniques. So repetitive stress injury. This is what it is said here. So we should be seeing that the type of patient should be varied in at regular interval, or we have to do such things in order to avoid the repetitive stress injuries. Then this is the main thing which we have to focus on. The exercise may offer a way for physiotherapists to reduce the rate and severity of work-related musculoskeletal disorders in practice. So we should have a regular exercise pattern in our lifestyle. It can be either in the morning or in the evening with small warming up exercises and some joint movements, some rotations of the shoulder, neck, hip, and ankles with mild stretching of the neck, the trunk, lower limbs, upper limb, everything. And emphasis on fitness at undergraduate level, and ongoing commitment to fitness may be important strategies to reduce injury in long term. So this we have to consider. I request IAP to note this point while framing the regulations of the curriculum. There should be a fitness program from the undergraduate level where we have to teach the students to in order to maintain their health in the career. Warming up exercise is very important. Warming up exercises we can do by simply stretching the hand up and go on the toes. Go on the toes, and you can go full stretch up with the toes standing, and then you can go for jogging and of 5 to 10 minutes running, and then you can come and do the stretching exercises and rotation movements and all sort of small strengthening exercises like push-ups or pull-ups or like squats and like planks, like core strengthening exercises we can do. And in the evening or any time where we get a free time, we can do the Jacobson's relaxation technique. It is very important to relax yourself. Uh, we are in the work, but we don't relax much. So we need to relax for some time. Jacobson's relaxation technique is much more effective. Dr. Edward Jacobson invented this technique in 1920, and this is as a way to help his patients deal with anxiety. And this technique is much important and have some variety of health benefits in relieving anxiety, reducing work-related stress, lowering your blood pressure, reducing likelihood of seizures, improving your sleep. So this Jacobson's relaxation technique is commonly used in people with insomnia, and also uh, we can also use it in our daily life. Okay, and the one of the I can demonstrate in words, not by showing. It is as simple as that. Like you lie down on supine lying, then you concentrate on your feet, bring attention to your feet, consider this as my feet, and then you slowly bend your toes, then curl your toes under, tighten your muscles gently, do not overstrain, feel the tightness, then you slowly relax, then you move, then you feel the relaxation. Okay, you concentrate on the feet muscles, tight slowly, hold it 5 to 10 seconds, don't overstrain, then you relax. The same thing that we can do it in abdomens and shoulders, neck, and everything, where we have to think about the muscle groups where we have worked a lot. Like as a physiotherapist, we will walk a lot, we will stand a lot, we will handle patients, we will move around, so our calf muscles will be more tight and our ankles will be more stressed. So and the feet muscles, the intrinsic muscles of the foot will be more tight. So this muscle can relax your foot muscles. Then you think about your knees, slowly contract your quads, tight it, feel it, then slowly relax it. Like that you can see think all the muscle groups, and you can contract, don't overstrain, hold it, then relax it and feel the relaxation. Like that, you can relax every group of your muscles. In abdomen is also like that. Slowly tighten your abdomen muscles. Don't overstrain. Feel the tension. Hold it for 5 to 10 seconds. Then relax your abdomen muscles. Like this, you will be aware of the abdomen muscles. Same thing, you can shoulder thing. Shoulder, you can shrug it upside. Hold it there. Hold it. Don't overstrain. Then slowly relax your shoulder. You think about the muscle and you relax your muscle. You get the feeling of tightness. Hold it there 5 seconds, then relax it. Like this, very gently. You can do this exercise. It will take only 10 to 15 minutes or maybe 20 minutes, and this can be done uh, in closed eyes or in open eyes. Which I personally do is the closed eyes. Closed eyes, you can concentrate more on your body parts. So Jacobson exercises is very much important in order to get relaxation in your busy schedule. Take 15 to 20 minutes every day. Think about your body and try to relax. Try to give adequate stretching. Try to rotate all your joints. Try to be uh, pain free and live happily. Physiotherapy should maintain an appropriate level of personal fitness for the work. So, while starting, while a patient is coming in your clinic, and if he or she is saying that you are very obese and you're not fit enough, then how they will think? So, we should be in such a way that the physique should be maintained and the fitness should be maintained properly. Now we'll see the uh, patient safety. We know that the patient safety starts with us, the creating a culture of safety. So the patient safety, the primary thing is it's derived from the Latin word, which means first do no harm. We are here to treat the patient. We are not going to harm them. So if we are going to make them correct, or we are not going to harm them. So this is the first and primary thing we should do. There should be no harm. WHO defined it as a framework of organized activities that create cultures, processes, procedures, behaviors, technologies, and environment in healthcare. WHO Global Safety Action Plan 2021-2030 emphasizes various actions from the stakeholders to promote zero harm for the patients. We emphasize so in our OPD, in our clinics, we emphasize safety from injuries, burns, falls, and fractures. So how there will be injury? It can be environmental. It can be due to a fall. Like it can be like overstretching a muscle. So all these things we should be taken care of. The burns can be from electrical hazard. So we should be thinking about the when you do the electrical stimulation or when you apply the TENS, make sure that the leads are properly placed and not going off the body. Because if the leads are very loosely packed, it can cause burns. And the gel or the hydration of the lead should be adequate in such a way that there is no dry surface in between the skin and the lead. And also the electrode should be placed intact with a strap or a velcro or a micropore. We should be taken care of. Then we should be very cautious about the falls of the patient. And when we give the passive movements or when you give the stretching, make sure that we are doing all the movements in the anatomical plane and direction of the joint. This is very important. Let's see the patient safety and physiotherapy in another perspective. There should be a knowledge of domains of patient safety protocols. All the therapists who are in the department should be aware of the patient protocol safety protocols, and they should be it is instructed to the HODs to ensure that all the therapists who is in the department is knowing the things. The training and feedback should be given about the patient safety protocol by the organization. It can be done in big institutions, like the big institution. There will be infection control session for all the employees. Like when we work abroad, there was so many classes from the infection control. But here, I don't know whether it is going on like this. But in our small clinics, we can give small training sessions in order to highlight the patient safety and infection control protocols, using resources to reduce the errors at work. Lifelong learning. We are learning every day. Every day we are updating ourselves. Every day we are competing ourselves. So we should be better each day. Yesterday's me is not today's Vishal. Yesterday I was little back. Now I am little forward. So we should move always little forward every day. collaboration with healthcare team. Other healthcare team also share their ideas, share their views about the patient safety. We can collaborate it with them and we can learn more. Link physiotherapy practice to physiotherapy education. Like like continuing medical education, we can go on learning. Like this is one of the process we are right now. What we are doing here. Domains of patient safety practice. Knowledge about the adverse events. As a physiotherapist, we must know we must have the knowledge about the factors such as infection control, near misses, errors, risk mitigation strategies. So in uh, big big uh, big institutions, big hospitals, they will be having a chart in order to note the near misses, errors, and risk mitigation. So in our clinics also we can do like this small charts where we can record the near misses and errors, and we can check the infection control protocols. Managing and acting at the moment. Physiotherapists must be aware of how to tackle the situation. There are three phases to tackle a situation: perception, understanding, and prediction. So, if you undergo any problem, if you see any problems, if you see any risk, we should be uh, knowing how to tackle the situations. There is three phases for tackling a situation. First, it is perception. Second is understanding and prediction. We move on to the perception first. The physiotherapist must be aware of the situation around, which includes people, environment, modalities, team members, action, patient details, medical records, and family members. So, while in a clinic setting or in an ICU setting or in a hospital setting, we should be aware of the environment, what all modalities is around. Like if you're seeing a ICU patient, you can see so many tubes connecting in. Sometimes ventilator is connected. Sometimes there will be urine tube. There will be Foley's catheter. Then there will be so many lines, IV lines, central lines. So we'll be knowing about the modalities. Then we'll be knowing, we'll be discussing about the condition, about a patient condition, and to the doctors, to the nurses. Then we'll have details of the patient and from the medical records. We'll talk with the family members. So we have a perception about the patient by combining all these things together. Then understanding, the physiotherapist must understand in a way to integrate these details to practice and understand how one factor affects all factors. So we should keep in we should keep in mind everything, the factors which can affect the patient's thing, like the practice, like the patient is financially down, or there are multiple factors with a head injury, like so we with the rib fractures. So in ICU setting, how can we deal with that patient? We see the records. We see some things are contraindicated for some things. Something is not connection with other things. So we should compile every details, and we should practice in such a way that we should not give a patient any harm, but we should benefit the patient. So these all understanding we should have. First we should first have the perception, then we'll have the understanding. Now we'll go to the prediction. Physical therapist, in a collaboration with other team members, shall create a checklist to be used to address the patient safety concern across different situations. So example, I'm saying this is a simple example. While transferring a patient from one place to another, pulling up the bed rails after treatment to prevent patient fall. This is a small example. So this is a small thing, but this is very important thing, because if the rails is not there, the patient might fall. The patient is falling means he'll get injured. So we are harming the patient. So this small thing can do great things. The second one is the crutch height. If you are teaching in the orthopedic condition, we are teaching a patient how to walk in a crutch. If the crutch is the height of the crutch is not adequate, it can cause axillary nerve injury. So each and everything what we are doing should be done very cautiously, and it should be done in a scientific way. Point of care assessment, risk assessment. Like we have a patient in our OPD, so we should be thinking about his patient cognition. So we are keeping mind, like if the patient is affected with on the brainstem, the neuropatient. and his balance and coordination is affected. So how we'll deal with that patient? If the patient stand up means he will fall down directly. So we'll be assessing the risk, and we'll be keeping in mind that he should not stand immediately, because if he stand immediately, he can fall down. So we should be with him. Then the environmental risk, like slipping or fall hazards or something like this. Then practice settings at a risk, like we say some people I have some therapists I have seen, they'll say to the patients, okay, do this thing, do that thing, and they'll go and see the mobile. It's not a good thing. It's not a good practice. Actually, we should be seeing the patient as a whole, and we should not leave him in isolation. So we don't know what is happening with the inner mind of the patient. Sometimes if he's standing up and if he's getting a fall, then we have to answer the thing. The likelihood of exposure to infectious agents like spills, like if there is a urine bag connected to the patient, then if it's spilling over, it can cause infection to other patients also. So this is spill management. So in some settings, in some clinic settings, we have spill kits. So spill kits we can arrange spill kits in our clinical departments, where we can do proper spill management. Okay, like this. Then infection control. Infection control protocols change in different areas from, for example, ICU protocol is different from the OPD protocol. So infection control, will have another day, and I think IAP Kerala will organize another webinar on infection control. Prevention of cross infection, patient to patient, patient to physiotherapist, physiotherapist to other physiotherapist, or physios to patients. So it is very important. We know now, because of the corona, we have learned much about infection control now. So use of PPE like masks, sanitizers, like disinfectants. We used to last 3 or 4 years. We used to have so much of experience with this infection control protocols. Use of appropriate PPE. If you're going in an ICU setup, we have to wear mask, gown, gloves, then N95 mask, then the head covering, the foot covering. But if you're going to an OPD, sometimes a mask itself is good. Or if you're going to a ward, sometimes you'll use gloves, sometimes you'll use N95 mask. And if you are going to an isolation room, again, we'll use the PPE kit fully, like gown, mask, head covering, foot covering, and gloves, like this. Proper disinfection procedures before and after patient visits. This is very much important. Whoever is a patient, before and after, we have to disinfect ourselves. This is the infection prevention and control guide. This we know actually. Last 2-3 years, we are doing the same thing: infection prevention and control visual guide. Elimination measures. First one is the elimination measure. See, the case of corona. We just think the case of corona. One patient is calling me. I am calling from the here, and I'm so and so. I need to consult you, but I have some sort of breathlessness or some sort of coughing. So what we'll say in phone? Okay, no problem. What is your problem? We'll try to manage in video call, or we'll try to manage in a voice call. So this is tele-rehabilitation services. Then we can screen the staffs coming in, screen the patients coming into the clinic. If they have any sort of infection, if they have any sort of or cough or a fever, we'll say not to come, because it can harm other physios and other patients. Okay. The next one is engineering measures, where we'll have the disinfection, the cleaning, the okay, yes. In OPD settings, what we have done before is that while one patient is coming in to the electrophysiology department, we'll place a paper roll. And after that patient, we will take those paper roll and we will disinfect the entire couch. And then another paper roll is kept for the another patient. So this can help in disinfecting the area where one patient have used. And proper ventilation should be there. And proper ventilation, disinfection is very important. Then the next one is the personal measures, the point of care assessment. And that I've just now discussed with you, the point of care assessment, risk assessment. We should be with the patients. We should collect all the details from the discharge summary, if it is an OPD patient, or from our assessment. Try to note down on the front page where the patient is having a risk of fall, and give proper care to that patient. Then hand hygiene is very important. We'll move on to hand hygiene next. Then proper wearing of the PPE, personal protective equipments, and admin measures, policies and procedures. This can be done by the head of the department in order to prevent the infection by maintaining and creating good policies and procedures. Contact tracing records, booking practices, and staff training. These all things is coming on the admin measures. This is the 5 moments of hand hygiene where we have to do the hand hygiene properly. There is 2 before and 3 after. The first one is before touching a patient, and the second before is before clean or aseptic procedures. Then the 3 after is the first one after body fluid exposure, and the second one is after touching a patient, and the third one is after touching a patient's surrounding. So there is 5 moments before and after. 2 befores, before touching the patient, before any procedures, and after body fluid exposure, after touching a patient, after touching his environment. So these 5 moments of hand hygiene we should use. There is 7 steps of hand hygiene. First, we can take either the alcohol-based hand rub, or we can use soap and water. If both, if you're doing with the alcohol-based gel, it can be, the hand hygiene can be done within 30 seconds. And if it is by the soap and water, we can do it within 1 minute. So the palm, you have to see the palm, how we'll rub. The first rubbing is palm facing together, palm to palm. Then the palm to back of both hands, then interconnected like this. Then the knuckles, we'll rub the knuckles like this. Then we'll move the thumb around like this. Then we will go with the nail like this. And lastly, we will move with the wrist. So there is 7 steps of hand hygiene: palm to palm, back, inter fingers, then knuckles, then we'll go for the thumb, then the nails, and then the wrist. This is the 7 steps of hand hygiene. Then we'll see the legal safety. This is one of the important point we should see. We should get a consent form for unexposed area palpations and treatment, and the caregiver assisted treatment should be done if treating opposite gender. And the one of the best thing which I have noticed that IAP India have done is indemnity insurance. So indemnity insurance will support you from various problems, legal issues. So I recommend every physios to do the indemnity insurance in order to be safe from the legal side. So you can ask your own questions, and if there is any questions, I can help you. You can place the questions in the chat box, and you can share your views, and you can share your experience if you can. If those who are willing can raise your hand, and I'm handing over the mic to the moderator. Thank you.
Thank you, sir. If you have any doubts, please do write in the chat box.
In the chat box, Dr. Ajish have sent one information. Everyone can see the. I think the panelist, Madam. Does this chat can be seen by all or
No,
by
it
the
can be only seen by panelists. I'll try to copy and send it to all of them.
Okay, ma'am. Okay. So the Dr. Ajish Sashidharan have shared an interesting research injury prevention by in physiotherapists. So madam will be sharing that thing to the audience.
That was really a great eye-opening session. Hope all the therapists will put this into action.
Yes, it was a good topic. Well explained. Thank you, Vishal. Thank you, Dr. Vishal.
Thank you, sir.
Now, let's move on to the vote of thanks. I call upon the co-chairperson, IAP National Branch Coordination Committee, Dr. Hariam Krishnan, to deliver the vote of thanks.
A very good evening to everyone. On behalf of IAP Pathanamthitta, first of all, let me extend our wholehearted thanks to IAP CEC and the IAP Kerala State Committee for the approval and support to conduct such a webinar. But usually, we will be conducting webinars on topics like related to physiotherapy practice. And this is a webinar which has been conducted related to the health of the physiotherapists who are doing the work so that we can continue serving the population with good health. Anyway, next I would like to thank each and every participants who are the real motivation to us to continue with this webinar series. I think this is the third one which we have started initiated recently from IAP Kerala along with the various branches that we have. And I'm sure that each one of us who have attended the webinar has got a deep insight into the health and safety issues that we can have during work and the various options that we are having to control that as well as to prevent those problems. And hats off to the efforts by Dr. Vishal Johnson for taking up this topic and working out with evidences on like the various options that we have to prevent as well as come out of this our health related issues as well as how safe we can do our practices. And next, heartful of thanks to our state president Sreet sir, to our vice president Vinod Raj sir, to our general secretary Jim sir, the women's cell coordinator Jayasri Krishna ma'am, all of them for their kind words as well as the the continuing guidance to all of us, as well as to Nishad sir, Sabida ma'am, Vinayan sir, from the Pathanamthitta team for taking up this initiative and supporting us to conduct this webinar. A special mention to Dr. Vincy Daniel for moderating this session effectively, and also a special thanks to the Central Digital team for their technical support, and the Dr. Adul from the State Digital team for the publicity support. Once again, thank you all, and hope you had a wonderful session, and we will be coming up with informative new as well as informative session in the coming days and months also. Thank you all once again. Thank you.
Thank you all.
Thank you, sir.
Thank you, sir.
I have shared the link in the chat box so everyone can refer to the same.
Thank you, ma'am.
Thank you, ma'am, for your wonderful coordination. Thank you.
Thank you, sir. Sir, may I end the session now?
Yes,
Sure,
ma'am.
ma'am.
Thank you so much, ma'am. Thank you very much.
Thank you, sir. Thank you very much.
Thank you, ma'am.